Today I went to Black Creek Medical and I received radio frequency and intense pulse light therapy. I hope you guys enjoy this video. Please subscribe to my channel to see what we have coming up next. We're going to start with radio frequency. It starts with application of ultrasound gel. Okay, so I have a paddle on my back as like it's a grounding type thing. And this roller is the radio frequency treatment. And it feels warm and it's actually not uncomfortable at all. It's kind of relaxing. If you have a jade roller at home, it feels just like it except a warm feeling. And I'll let Jamie tell you what it's actually doing. In technical terms, what it's actually doing.
So radio frequency isn't a new technology. It's been around for a really long time in medicine. However, depending on the wavelength that you're using with radio frequency and the ability to treat a specific area at a specific heat for a specific duration of time, you're able to get what the FDA has cleared as improvement in the appearance of fine lines and wrinkling, and what we found anecdotally is a tremendous amount of skin tightening. So we use radio frequency to contour the face. We do a lot of submental tightening, which is under the chin area, and we combine it with our sculpture fat destruction machine. We first get the submental fat using the sculpture machine, and then we tighten and contour with radio frequency.
So, in all those words, it sounds so scientific and wonderful. We're going to make my neck look a little bit skinnier, and we're trying to get rid of at least a couple of the estrogens, basically. And now we switch to the other side for a few moments.
Yeah, and the redness lasts about 20 to 30 minutes. It's just red because the skin has reached 41 degrees Celsius for the treatment period. So it's just heated up. And I would say there's very little downtime with this procedure. You might have some mild tenderness, but this is a lunchtime procedure for sure. You can have this done and go right back to work.
Are you uncomfortable?
Not in the least. I'm so relaxed. So here Jamie is starting with the IPL, and you'll see the flash of the laser. Each time it flashes, there is some pain, but it is completely tolerable.
What is this procedure supposed to do?
You want to tell them what's
I probably can't talk.
So this is our IPL laser. So IPL is technically not a laser, it's intense pulse light. But IPL is very, very well studied for addressing hyperpigmentation. So that's going to be the brown spots that are caused by sun damage. It also is very efficacious and has been clinically studied for acne treatment and also for the abatement of rosacea. So what a patient's going to expect after this treatment is that the hyperpigmented areas come to the surface of the skin. The laser is attracted to the melanocytes. And so the melanin will actually come to the surface of the skin and interact with the oxygen and slough off. So you'll see a tremendous decrease in the browns that are available in the skin. Then secondarily, you're going to see a big improvement in the reds. So all those little tiny vascularized capillaries, as the skin thins, all of the blood vessels get closer to the surface. So this is really going to help with all the browns and the reds in the skin. This procedure is not pain-free. Lacey, what do you think?
It's pretty intense. They say it feels like a rubber band hitting you. I disagree with that. I think it's a lot harder than that.
Yeah, it's hot. So I mean, Lacey's doing a really good job right now, but the laser feels hot. Our laser is really great because it actually has a sapphire cooling tip at the end, so as I drag it across, Lacey should feel like a slight cooling feeling. It does not negate the heat that comes with each fire of the laser, but it at least helps a little bit. After we're done at area, Lacey can cool her face with ice, and that really does help. And for the rest of the day, her face will continue to feel warm. For the IPL treatment, so you're going to want to see a generalized redness of the skin. Lacey has a lot of redness on her face anyway.
Yeah.
In patients who have a lot of obvious browns, the browns will already start to come up. So you're going to see, just generalized redness. You're going to see some erythema, some puffiness in the face. Sorry, the erythema is the redness in the face. The edema is going to be the puffiness in the face.
And this rollerball feels like heaven.
What is it cold? The rollerball?
It is cold.
Yeah. So this really helps with the heat, and then we'll apply a post-procedure gel to sort of take the heat down a notch. And she's gonna and some sunscreen. With this treatment, you're gonna want to definitely make sure that you're out of the sun. Because it's gonna make you very photosensitive, and you're gonna want to sit in the shade and double up on your sunscreen. And
Yeah, on the video here, you can see the redness in her face a lot more than just me looking at her.
yeah. Yeah, it's funny how the iPhones have the coloration, they're like a fisheye, so they change the angle and they change the color a little. So to me, she looks pink, but not red, which would be appropriate post-procedure.
The pain level right now, so I would say, like it's burning, like it feels like a sunburn.
Mm-hmm. Yes.
It's not unbearable.
Yes, it is. This should feel hot, like a sunburn. You're exactly right. Like where your skin feels tight and hot, and there's some heat in it.
It's not anything like crazy bad, like some people make it out to be.
Yeah, and then you can notice too, we're about 30 minutes post IPL. You can already notice our post radio frequency in her neck, and I mean, to me, there's already a good tightness in the tissue itself.
Yeah, I can tell the difference.
Yeah, and it has. Radio frequency is one of those things where you can see almost immediate results. That you're going to see an improvement in the laxity of the skin. That it's going to pull back on itself,
and then it continues like for days and days. You keep seeing it like shrink up.
Yeah. Radio frequency has a collagen building effect, so that's going to be a treatment that has a therapy time of about 6 months. In the face, the interval's every other week for about 4 to 5 treatments. In the body, it's every other week for about 6 to 8 treatments, and that'll have a lingering effect for about 6 months. Our follow-up after the series is a 6-month follow-up, and you should have 1 visit in a given treatment area once every 6 months to a year, depending on your needs. And IPLs can be done once every month till the hyperpigmentation and the redness is addressed.
You guys, that rollerball is ice cold and it feels so good on my face.
I'm good.
So good.
Good now?
Hey polka dot peeps, thanks so much for watching. Please be sure to subscribe to my channel to see what we have coming up in our next video. You never know what it's gonna be.